Hi everybody. Today I am going to discuss another topic. Topic is morphology of cell injury. Morphology of cell injury. This is the simple diagrammatic representation of reversible cell injury. Then next one is simple diagrammatic representation of irreversible cell injury. You just both these pictures. You just go through this and understand the picture, and most of the MCQ questions will comes in this picture also. Okay, you go through this. Okay, in this first one is morphology of reversible cell injury. In morphology of reversible cell injury, first one is cellular swelling. Next one is hyaline change. Next one is mucoid change. Then next one is fatty change. First one is cellular swelling. First one is cellular swelling. It is otherwise called cloudy swelling, or also known as hydrophic change or vascular degeneration. So, cellular swelling is also known as cloudy swelling, hydrophic change, or vascular degeneration. Because of gross appearance of affected organ, this is known as cloudy swelling. Accumulation of water within the cell, that is hydrophic changes. Also due to cytoplasmic vacuolation within the cell, vascular degeneration. This is the commonest and the earliest form of cell injury. So, what is the commonest and the earliest form of cell injury is cellular swelling. Then, what are the causes of cellular injury? What are the causes of cellular injury? First one is bacterial toxins. Next one is chemicals. Next one is poisons. Then next one is burns. Next one is high fever. Then next one is intravenous administration of hypertonic glucose or saline. These are the causes of cellular swelling. What are they? Bacterial toxins, chemicals, poisons, burns, high fever, intravenous administration of hypertonic glucose or saline. This is the pathogenesis of cellular swelling. What is? First one is pump failure. Then that it will lead to increased influx of sodium and water. It leads to cellular swelling. Then what is the pathology? Pathology of cellular swelling. In pathology, first one is gross appearance. Gross appearance, the affected organs such as kidney, liver, heart muscles are enlarged due to swelling. So, what are the microscopic appearance pathology in cellular swelling? Is small clear vacuoles are seen in the cytoplasm. The cells are swollen, microvasculature compressed. These are the microscopic appearance in cellular swelling. Also, hydrophic swelling is entirely reversible if the injurious agent is removed. If the injured agent is removed, the hydrophic swelling is entirely reversible character. So, these are the cellular swelling. Next one is hyaline change. Next morphology of reversible cell injury is hyaline change. Hyaline change is also known as hyaline degeneration. Hyaline means what? Glassy appearance, and it derived from the word hyalos, means glass. So, hyaline means glass appearance, and it derived from the word hyalos. Hyalos means glass. Then, alterations within the cells or extracellular space that give homogeneous glassy pink appearance in routine histological section stained with the eosin or hematocylin. These are the staining techniques, eosin and hematocylin. Then hyaline change may intracellular hyaline and extracellular hyaline. These hyaline changes, there are two types are there. What are they? Intracellular and extracellular. Intracellular and extracellular. This is the hyaline change picture. Then first one is intracellular hyaline changes. It may seen in epithelial cells. This intracellular change is seen in epithelial cells. Example, hyaline degeneration of voluntary muscles, also called as Senger's degeneration. Senger's degeneration seen in rectus abdominis muscle. Rectus abdominis muscles in typhoid fever. So the muscle loses its fibrillar staining and it became glassy and hyaline. This is Senger's degeneration. Also, Mallory's hyaline degeneration is commonly seen in hepatocytosis in alcoholic liver cell injury. Mallory's hyaline degeneration is commonly seen in hepatocytosis in alcoholic liver cell injury. Also, Russell's bodies representing excessive immunoglobulin in the rough endoplasmic reticulum of plasma cells. These are the what intracellular hyaline. This is the Senger's degeneration picture. Then this is Russell body. The arrow will show the Russell bodies. This is the intracellular hyaline changes. Then next one is extracellular hyaline. It is commonly seen in connective tissue. Its example means hyaline degeneration in leiomyoma of uterus. Hyaline degeneration in leiomyoma of uterus. Then hyalinized old scars of fibrocollagenous tissue. Then hyaline atherosclerosis of renal vessels in hypertension and diabetes mellitus. Then corpora amyliaca are rounded masses of concentrated hyaline mabine seen in the prostate in elderly, in the brain and spinal cord in old age and old infants of lungs. These are the extracellular hyaline changes. Extracellular hyaline changes in hyaline changes. Okay. Then these are the morphology, reversible cell injury in types 2 hyaline changes. Then next one is mucoid changes. In mucoid changes, mucoid generation is also known as mucoid degeneration. Mucus is secreted by mucus gland is a combination of proteins with mucopolysaccharide. The gland is combination of proteins with the mucopolysaccharide. Then mucin is one of the chief constituents of mucus. It is a glycoprotein. Also, mucin is normally produced by epithelial cells of mucous membrane and mucus glands and sold by some connective tissue. Mucin is normally produced by epithelial cells of mucous membrane and mucus glands and also by some connective tissue. Then in this mucoid changes, there is first one is epithelial mucin. Epithelial mucin. Some examples of disturbance of epithelial mucins are cataractal inflammation of mucous membrane. Example, what are there? Respiratory tract, alimentary tract, uterus. These are the cataractal inflammation of mucous membrane. Then next example for epithelial mucin is obstruction of duct leading to mucocil in the oral cavity and the gallbladder. Then next one is cystic fibrosis of the pancreas. Then next one is mucin secreting tumors. Example of ovary, stomach, large bowel, etc. Okay, these are the epithelial mucin. Then next one is mucoid changes example. This is connective tissue mucin. In connective tissue mucin, example disturbance of connective mucins. Mucoid degeneration in some tumors. Example, myxomas, neurofibromas, fibroadenoma, soft tissue sarcomas, etc. Then next one is myxomatomas, changes in the dermis in myxedema. Next example is myxoid changes in the synovium in ganglion of the wrist. Then dissecting aneurysm of the aorta. These are the example for connective tissue disease. Then these are the mucoid change. These are the mucoid change. Then next one is fatty change. Fatty change is also known as fatty degeneration or steatosis. Steatosis. What do you mean by steatosis? Stia means fat, and steatosis means accumulation of fat. Also, there is one term is the steatoria. Steatoria means stool containing fat. And this is the steatosis. Steatosis means accumulation of fat. Then fatty changes is the intracellular accumulation of neural fat. Neural fat is triglycerides within the parenchymal cells. The deposited in the systole. The fatty changes is commonly seen in the liver. We all know that major organ involvement is the major organ involved in the fat is liver. So mainly the fat changes commonly seen in the liver, but it may occur in the not fatty tissues like heart, skeletal muscle, kidneys, and other organs like lipid nephrosis or minimum changes disease. So, but the majority cases, major part of the fatty changes are happening in liver. In the major part in liver, but in minor part also there. That is the kidney, heart, skeletal muscle, other etc. organs. Okay. Then next one is fatty liver. Liver is the I told now itself that liver is the common site for accumulation of fat because what is the reason? Because the liver is the important part for fat metabolism. Then what are the etiologic reason for fatty liver? It may caused by a number of reasons. It may be caused by some number of reasons. In this some of the reason, in this among the highest amount of reason, in some of the reason I am in here mentioning that. First one is toxins. Second one is alcohol abuse. Third one is protein malnutrition. Fourth one is diabetes mellitus. Then fifth one is obesity. Then next one is anorexia. Then next one is chronic illness. Chronic illness example, TB. TB means tuberculosis. Also, among these, alcohol abuse and diabetic associated with obesity are the most common cause of fatty changes in the liver. In this, first one is alcohol abuse and the second one is diabetic mellitus. These are the main two conditions which will cause the fatty changes in liver. Then, depending upon its etiology, it is divided into two types: non-alcoholic fatty liver and alcoholic fatty liver disease. Depending upon etiology, it is divided into two types are there: non-alcoholic fatty liver and alcoholic fatty liver. First one, then next one is pathogenesis of fatty liver. Normally, lipids are derived from two sources: from diet as chylomicrons and as free fatty acids, and the next one is from adipose tissue as free fatty acids. In this, free fatty acids from either of these sources enter the liver cells. The two sources are there. Either one of these from sources will enter the liver cells. Normally, a small part of the fatty acids is synthesized from acetate in the liver cells. Most of the fatty acid is esterified to triglycerides by the action of alpha glycerolphosphates. Only a small part is changed into cholesterol, phospholipids, and ketone bodies. Intracellular triglycerides requires lipid acceptor protein to form lipoprotein. They form in which lipids are normally excreted from liver cells. This is the diagrammatic representation. Diet I refer to. There is two free acid. There is two from two sources that are free fatty acids are coming. from diet and adipose tissue. This is the diagrammatic representation. Okay. Then, excess accumulation of triglycerides may result from defect at any step from fatty acids entry into lipoprotein system. Then increased entry of free fatty acids. Then what will happen? Increased entry of free fatty acids into the liver. Then it will what will happen? Increased synthesis of free fatty acids by the liver. Due to this reason, decreased conversion of free fatty acids into ketone bodies, resulting in increased esterification of fatty acids to triglycerides. So, this will happen. What will happen? Increased alpha glycerophosphate causing increased esterification of fatty acids to triglycerides. So, decreased synthesis of lipid acceptor proteins resultation in decreased formation of lipoprotein from triglycerides. Which is what will happen? Block in the excretion of lipoprotein from the liver into plasma. This is the pathology. Pathology. What will happen? First one is liver is cellular. The picture will first in picture. First picture shows the healthy liver and the second picture is fatty liver. First liver is cellular. Then rounded inferior margin. Then smooth capsule will be occur. Then this is the macroscopic picture. Then next one is microscopic appearance. There are lipid vacuole in the cytoplasm of hepatocytes. That is vacuolation and vacuolation of hepatocytes. Then vacuoles are initially small and are present around the nucleus. That is microvascular. Then with the progression of process, the vacuoles become larger and pushing the nucleus to the periphery of the cell. That is macrovascular. Then hepatocytes laden with the large lipid vacuoles may rupture and the lipid vacuoles may unite together form the fatty acids. Then lipogranulomas may appear and consist of lymphocytes and multinucleated giant cell. These are the microscopic appearance. This is a lipid vacuoles. So with this, morphology of reversible cell injury is over. Thank you. അപ്പോ പറ്റുന്നില്ലേ? അയ്യോ പറ്റുമോ ഇനി?